Ladies and gentlemen, please welcome Kimberly Cernak of the Eleanor Crook Foundation and our esteemed panel.
Hi everyone, it's an honor to be here today. My name is Kimberly Cernak and I serve as the Managing Director at the Eleanor Crook Foundation. ECF is a US-based private philanthropy and we're exclusively focused on the fight against child malnutrition. Investing in the fight against malnutrition is an investment in child survival. Of the nearly 5 million kids who died in 2022 before the age of 5, about half of them died to causes related to malnutrition. And this is a tragedy that's made even more tragic by the fact that there are cost-effective and proven interventions that could be deployed but just aren't reaching kids at scale. I'm really excited to be with this panel today to talk about how to solve this challenge, but I want to start by telling a quick story. It was 42 years ago this month that Jim Grant convened about 20 people at a conference room at UNICEF headquarters right down the street. Jim Grant became Executive Director of UNICEF just a couple years prior, and this was the day that he was going to reveal to some of his most senior staff his focus and vision for the future. He called everyone into a conference room. I can imagine they were pretty excited to hear the new boss's vision, and as they sat down, he affirmed that UNICEF would take on even more audacious goals to save lives. He told the room that in the next couple of years, UNICEF would set out to double coverage of child immunizations, and that by the end of the decade, they would double it once again. He laid out a few similarly bold targets in other areas and then dismissed the team to get to work. I can imagine if the group walked in excited to hear his vision, they probably left a little bit stunned, and some of them were probably even a little bit concerned. UNICEF had an impeccable reputation, but they had very limited budget, and now the team was being asked to do a whole lot more with no more money. Of course, in the end, we know that Grant's vision prevailed. UNICEF met many of Grant's targets on schedule, including the immunization target, and at the time of his death in 1995, it was estimated that 25 million kids were alive thanks to his vision that would have otherwise not survived. Today, much has improved, but much, of course, is still left to be done. And the next frontier of the child survival, I believe, is ours to advance, but it will require the sort of bold vision, collaborative partnerships, and drive that we've seen worked in the past. I'm really thrilled to be joined by a group of panelists today to talk about how we can harness past vision and drive forward even more progress. So on the stage today, we have Dr. Marea Hatziolos Grant, Principal at Ocean Stewardship, and Jim Grant's daughter-in-law. We have Ms. Helga Fogstad, Director of Health at UNICEF, and Chandra Gautam, who served in many capacities at UNICEF, including as a Deputy Executive Director under Mr. Grant's tenure. So Marea, I'd love to start with you. Your father-in-law had a vision for the world in which children no longer die from preventable and treatable causes. And as I mentioned, he had a lot of doubters and a lot of critics along the way. Many questioned whether his approach would work and whether it would have the impact that he intended. But of course, he and UNICEF prevailed. So I'd love to hear a little bit more from you. How do you think he did it? What were the tools and the approaches that he deployed to make such an impact?
Well, thank you, first of all, for inviting me to be on this panel and to the Eleanor Crook Foundation for making this possible. Let me start by saying that Jim was an optimist by nature. He had a strong moral compass and an uncompromising work ethic. Growing up in China in a family of medical and public health trailblazers, he was guided early on by a family tradition of public service. He was a visionary. His dream was to lift people out of poverty, and when he was named Executive Director of UNICEF in 1980, he saw UNICEF as his platform and children, society's most precious asset, as the way to achieve this vision. He knew he had to be laser-focused on simple, proven, accessible, and cost-effective technologies, and he had to demonstrate their success. So he relied on early adopters, as we saw in Colombia and the Philippines, to take on this challenge. And he thought that this was key to getting world leaders and also members of his own agency who had sometimes were dubious of the possibility of doing this, to make the case that taking these simple, cost-effective interventions to scale was not only doable, but a moral imperative. So some of the unique methods of Jim's approach were keep it simple, but take it to scale. Translate your big ideas into simple interventions that could be replicated in villages, in provinces, and at the national level throughout the developing world. Get everybody on board and build strategic alliances. Jim was a force of nature. When he set his mind to something, he was all in, but he knew he couldn't do it alone. He needed allies. And to do this, he set out to make the case to bring everybody on board. He personally met with scores of heads of state, religious leaders around the world, and made the case for universal immunization and building the political will that he needed to get to 90%, 80% immunization by 1990. Another important thing was measuring results and reporting on them. Keeping track of progress and using it to publicize success was absolutely essential to accelerate the efforts to get from 20% to 80%. Knowing that success was there if one could grab it was really key. And then leading from behind, catalyze leadership in others, give them the credit and make it their success story. Jim knew that to mobilize and maintain the alliance of world leaders, they had to take personal ownership of the child survival revolution. So UNICEF worked feverishly behind the scenes to convene a world summit for children in 1990, in September of 1990. And the point of this summit was not only to celebrate the collective success of these world leaders in helping achieve 80% immunization by 1990, but to get them to commit to the next stage of the revolution, which was implementing the action plan for child survival and development. Thank you.
Awesome. So many lessons there that I know UNICEF continues to carry forward as we look to the present and to the future. So Helga, I'd love for you to spend a little bit of time explaining to us around how UNICEF is applying the lessons learned in that era to modern challenges.
Yeah, thank you very much. And I think that, in the era of 1980 to 1995, Jim Grant was an inspiration to very many, not only leaders, but also healthcare professionals all around the world. And we carry his voice in us to this day. And it was not only in that period where, preventable deaths were reduced, but also after. And so that is very important, and one has implemented a lot of the initiatives started. And I think one has saved a lot of million lives and improved children's well-being. I think what is now in our implementation and UNICEF's implementation is very much in the community, and that's where a change has had to happen. What we are seeing now is that the attention on equity is important. So looking at where deaths are occurring and how we can help countries mobilize common efforts in order to to really bend the curve. And this is a number of the 10 to 20 countries that need actually to do it. If not, we will not reach the SDGs. Another is poverty. Children in poverty are disadvantaged and need to be focused, and this is important to really see how that attention on equity and equality can be read. The other thing is conflict and fragile settings, and this is an area that we increasingly are challenged, and this is where we need to focus on. So I think that we are very much UNICEF. We have him still in our heads. He's the Jiminy Cricket for all of us. And I think that the implementation at the community level is something that we're focusing on.
Awesome. And cool, you wandered the halls of UNICEF with Executive Director Grant in a number of capacities, including as Deputy Executive Director, and saw his leadership up close. So I'd love for you to give us an example of how his work and dedication and your contributions as part of the team really helped to make the, quote, impossible possible.
Well, it is worth recalling that when Jim Grant became the head of UNICEF, health was not a very high priority. It's a technical medical issue. It was not a political priority. Jim Grant's greatest contribution was to lift health from a technical medical issue to a political issue at the highest political level. How did he do that? Whenever people said, let's have this ambitious goal, and ministers said, oh, it cannot be done, it's too difficult, Jim would never take no for an answer. He would go to their heads of state, to their presidents, prime ministers, governors, kings, and say, Your Excellencies, this is so important, saving children's lives. It is not only a health issue, it will be politically beneficial for you. This is something that you can do that will be good for your country. And buoyed by the early success of immunization and other activities, he became even more ambitious. And once, as Marea said, he wanted to call for a summit for children. You know, many people said, what? Summit for children? Leaders don't meet to talk about little kiddies. They meet to talk about war and peace and trade and commerce and economy. Jim Grant said, no. If leaders were to meet, they could never agree on war and peace issues because there's contested issues. Who can be against children? Children is the only issue on which we can mobilize leaders together. And guess what? He was prophetic, because in the end, the Summit for Children became the largest gathering of world leaders in history until that time. Since then, there have been bigger summits. Ambitious goals were set. The needs of children were turned into the rights of children, human rights of children. But skeptics would often say, oh, at the United Nations, goals are ever set but never met. Jim Grant and UNICEF under his leadership proved them wrong, because many of those goals were actually achieved, and the impossible became possible. It actually became a norm, and those goals that were set for children later on became the foundation for the Millennium Development Goals and today's Sustainable Development Goals that are driving the world's development agenda. That's how he made the impossible possible.
Awesome. As I think the audience can tell, this is a panel with a lot of great stories. So hopefully you'll have a chance to catch up with each of them afterwards. But in the interest of time, I'll ask just one last question to each of you. Jim Grant was known for saying morality must march with capacity. And that was meant to be a call to action to match the goals with action and resources, as you just alluded to. What capacity is needed today to make child survival a reality for all?
Well, I'd sort of like to reframe the question, because I think that the real question is not capacity, but moral commitment. We have the capacity today to achieve many of these goals to reduce infant mortality. But what will it take to raise the level of moral commitment and political will to save the lives of children from preventable disease? How do we create the political will to keep the world's attention on achieving attainable child survival goals and the prospect of a healthy and fulfilling future when there are so many other pressures and things grabbing world attention? So I think the key is really the commitment. We have the capacity, it's getting the political will to mobilize the resources required and to just get to work and do it.
Helga?
I agree with Marea. This is really a political commitment that is not automatically put on the agenda by politicians. And so we have to keep them accountable and ourselves accountable too. So I think that there needs child survival and child survive, thrive, and transform agenda has to be put on the agenda again in a very tangible way. And all the interventions that are known need to be highlighted, and the capacity of the systems to be strengthened in order to make sure that human resources, supply chains, drugs are strengthened in an aligned fashion. Because I think this is an important agenda that we all unite and do not duplicate, but really emphasize.
How about you, Cool?
Well, the capacity to do good in the world today is immeasurably higher than the capacity it ever was. But sadly, as we see in the death and destruction in Gaza, in Myanmar, in Sudan, in Ukraine, elsewhere, the morality and capacity are not marching together. In a world of great economic prosperity on the one hand, we also have great economic disparities and health disparities. and Grant's call for morality to march with capacity has not been fulfilled yet. What is missing is not capacity. It is the political will. And I would say that that will needs to be cultivated. I'm glad to hear that happily UNICEF continues to pursue the Jim Grant's legacy of marching capacity and morality together. Not only UNICEF, Eleanor Crook Foundation, results that I'm associated with. There are many organizations that also believe in generating the political will so that the capacity marches with morality. And I see in Eleanor Crook's Foundation's work a tremendous example, the moral compass that Jim Grant talked about. I think you are fulfilling it in the domain of nutrition, where your founder says that her vision is to see every mother to be able to nourish her child. Bless you, Eleanor Crook Foundation, the other organizations and partners, Results, UNICEF, for carrying forward Jim Grant's legacy that continues to inspire us all, even today.
All right.
Well, thank you so much. We've obviously only scratched the surface here today, and I appreciate your kind words, but I know we're in a room filled with people who are doing their very best to make a difference and to match what we know with what people need and to get the services and innovations to people who need them most around the world. And I would bet that many of you have really bold ideas or vision, and I would bet that probably some of you have been told that those ideas are a bit crazy or a bit too audacious. And hopefully today is just a reminder that it is those big ideas and those big goals that kids really need to be able to survive and thrive. Jim Grant's story has deeply inspired me and our team at the Eleanor Crook Foundation, and his legacy has really served as an inspiration for our own strategy about how we deploy our resources in our work. And so with that in mind, it's my honor to share today that along with the Grant family, the Eleanor Crook Foundation is establishing the James P. Grant Child Survival Award. Beginning in 2025, we plan to award a contemporary leader who's demonstrably committed to scaling solutions for child survival. Our hope is that an award named for Jim Grant will support innovation among forward-looking leaders who have continued his legacy on child survival, and we hope it will also play a part in redirecting attention across the world to scaling high-impact solutions to save lives. So we're really excited to share more about the nomination process and the selection process in the coming months and to honor the first recipient next year. And with that, I'd like to invite Marea to close, speaking a little bit more about your father-in-law's legacy and the promise and the potential of the James P. Grant Child Survival Award.
Well, first of all, let me say how delighted I and my entire family are with the announcement of this award. We are just thrilled to be able to partner with the Eleanor Crook Foundation and other NGOs and international organizations in the field of health working on this. It's a terrific opportunity, and I know that Jim would be so thrilled. Part of his greatness was having a bold vision that he actually was able to implement, to see results on the ground and take to scale. And what his legacy was for all of us was thinking big, getting the political will to actually implement, and creating the partnerships and allegiances that were necessary to realize this global vision. So what we hope with the Eleanor Crook Foundation's award in Jim's memory is that people who have already demonstrated outstanding work in this area, but also people who could be inspired by this award and Jim's legacy to carry on this dual charge of presenting a bold vision and mobilizing the resources, but particularly the political will to put children once again at the heart of sustainable development.
Bravo.
Thank you all.
Thank you.